Let's see an NCLEX RN video on care for preconception client. A client has obtained levonorgestrel 0.75 mg, 2 tablets as emergency contraception. After unprotected intercourse, the client calls the clinic to ask questions about taking the contraceptives. The nurse realizes the client needs further explanation when she makes which of the following responses. I can wait 3 to 4 days after intercourse to start taking these to prevent pregnancy. My boyfriend can buy Plan B from the pharmacy if he is over 18 years old. The birth control works by preventing ovulation or fertilization of the egg. I may feel nauseated and have breast tenderness or a headache after using the contraceptive. So this levonorgestrel 0.75 mg, that is a Plan B medicine for contraception. Pills are more effective if taken immediately after unprotected intercourse and then again 12 hours later. And males are able to purchase these contraceptives as long as they are over 18 years of age. Common side effects include nausea, breast tenderness, vertigo, and stomach pain. An antenatal G2T1PO-AO-L1 client is discussing her postpartum plans for birth control with her healthcare provider. In analyzing the available choices, which of the following factors has the greatest impact on her birth control options? Satisfying with prior method, preference of sexual partner, breast or bottle feeding plan, desire for another child in 2 years. So birth control plans are influenced primarily by whether the mother is breast or bottle feeding her infant. The maternal milk supply must be well established prior to the initiation of most hormonal birth control methods. Low dose oral contraceptives would be exception. Use of estrogen or progesterone based pills and progesterone only pills are commonly initiated from 4 to 6 weeks postpartum because the milk supply is well established by this time. Prior experiences with birth control methods have an impact on the method chosen, as do the preferences of the client's partner. However, they are not the most influential factors. Desire to have another child in 2 years would make some methods such as an IUD less attractive but would still be secondary to the choice to breastfeed. After the nurse instructed a 20-year-old nullly gravid client on how to perform a breast self-examination, which of the following client statements indicate that the teaching has been successful? I should perform breast self-examination on the day my menstrual flow begins. It's important that I perform breast self-examination on the same day each month. If I notice that one of my breasts is much smaller than the other, I shouldn't worry. If there is discharge from my nipple, I should call my healthcare provider. The nurse determines that the client has understood the instructions when the client says that she will notify her primary healthcare provider if she notices discharge or bleeding, because this may be symptomatic of underlying disease. Ideally, breast self-examination should be performed about 1 week after the onset of menses because hormonal influence on breast tissue are at a low rate at this time. The client should perform breast self-examination on the same day each month only if she has stopped menstruating, as with menopause. The client's breasts should mirror each other. If one breast is significantly larger than the other, or if there is pitting of breast tissue, a tumor may be present. Which of the following would be important to include in the teaching plan for the client who wants more information on ovulation and fertility management? The ovum survives for 96 hours after ovulation, making conception possible during this time. The basal body temperature falls at least 0.2 degree Fahrenheit after ovulation has occurred. Ovulation usually occurs on day 14 plus or minus 2 days before the onset of the next menstrual cycle. Most women can tell they have ovulated because of the severe pain and thick scant cervical mucus. For a client with a typical menstrual cycle of 28 days, ovulation occurs usually on day 14 plus or minus 2 days before the onset of the next menstrual cycle. Stated another way, the menstrual period begins about 2 weeks after ovulation has occurred. Ovulation does not usually occur during the menses component of the cycle when the uterine lining is being shed. In most women, the ovum survives for about 12 to 24 hours after ovulation, during which time conception is possible. The basal body temperature rises 0.5 degree Fahrenheit to 1 degree Fahrenheit when ovulation occurs. Although some women experience some pelvic discomfort during ovulation, which is known as Mittelschmerz, severe or unusual pain is rare. After ovulation, the cervical mucus is thin and copious. Which of the following instructions about activities during menstruation would the nurse include when counseling an adolescent who has just begun to menstruate? Take a mild analgesic if needed for menstrual pain. Avoid cold foods if menstrual pain persists. Stop exercise while menstruating. Avoid sexual intercourse while menstruating. The nurse should instruct the client to take a mild analgesic such as ibuprofen if menstrual pain or cramps are present. The client should also eat foods rich in iron and should continue moderate exercise during menstruation, which increases the abdominal tone. Avoiding cold foods will not decrease dysmenorrhea. Sexual intercourse is not prohibited during menstruation, but the male partner should wear a condom to prevent exposure to blood. After conducting a class for female adolescent about human reproduction, which of the following statements indicate that the school nurse's teaching has been effective? Under ideal conditions, sperm can reach the ovum in 15 to 30 minutes, resulting in pregnancy. I won't become pregnant if I abstain from intercourse during the last 14 days of my menstrual cycle. Sperms from a healthy male usually remain viable in the female reproductive tract for 96 hours. After an ovum is fertilized by a sperm, the ovum then contains 21 pairs of chromosomes. Under ideal conditions, sperm can reach the ovum in 15 to 30 minutes. This is an important point to make when adolescents who may be sexually active. Many people believe that the time interval is much longer and that they can wait until after intercourse to take steps to prevent conception. Without protection, pregnancy and sexually transmitted diseases can occur. When using the abstinence or calendar method, the couple should abstain from intercourse on the days of the menstrual cycle when the woman is most likely to conceive. Using a 28-day cycle as an example, a couple should abstain from coitus 3 to 4 days before ovulation and 3 to 4 days after ovulation, that is days 10 through 14. From a healthy male can remain viable for 24 to 72 hours in the female reproductive tract. If the female client ovulates after coitus, there is a possibility that fertilization can occur. Before fertilization, the ovum and sperm each contain 23 chromosomes. After fertilization, the conceptus contains 46 chromosomes unless there is a chromosomal abnormality. A 20-year-old nullly gravid client expresses a desire to learn more about the symptothermal method of family planning. Which of the following would the nurse include in the teaching plan? This method has a 50% failure rate during the first year of use. Couples must abstain from coitus for 5 days after the menses. Cervical mucus is carefully monitored for changes. The male partner uses condoms for significant effectiveness. The symptothermal method is a natural method of fertility management that depends on knowing when ovulation has occurred. Because regular menstrual cycles may vary by 1 to 2 days in either direction, the symptothermal method requires daily basal body temperature assessment plus close monitoring of cervical mucus changes. This method relies on abstinence during the period of ovulation, which occurs approximately 14 days before the beginning of the next cycle. Abstinence from coitus for 5 days after menses is unnecessary because it is unlikely that ovulation will occur during this period. Typically, the failure rate for this method is between 10 to 20%. Although a condom may increase the effectiveness of this method, most clients who choose the natural methods are not interested in chemical or barrier methods of family planning. Before advising a 24-year-old client desiring oral contraceptives for family planning, the nurse would assess the client for signs and symptoms of which of the following: anemia, hypertension, dysmenorrhea, acne vulgaris. Before advising a client about oral contraceptive, the nurse needs to assess the client for signs and symptoms of hypertension. Clients who have hypertension, thrombophlebitis, obesity, or a family history of cerebral or cardiovascular accident are poor candidates for oral contraceptives. In addition, women who smoke, are older than 40 years of age, or have a history of pulmonary disease should be advised to use a different method. Iron deficiency, anemia, dysmenorrhea, and acne are not contraindications for the use of oral contraceptives. Iron deficiency anemia is a common disorder in young women. Oral contraceptives decrease the amount of menstrual flow and thus decrease the amount of iron loss through menses, thereby providing a beneficial effect when used by clients with anemia. Low-dose oral contraceptives to prevent ovulation may be effective in decreasing the severity of dysmenorrhea. Dysmenorrhea is thought to be caused by the release of prostaglandins in response to tissue destruction during the ischemic phase of menstrual cycle. Use of oral contraceptives commonly improves the facial acne. After instructing a 20-year-old nullly gravid client about adverse effect of oral contraceptives, the nurse determines that further instruction is needed when the client states which of the following as an adverse effect: weight gain, nausea, headache, ovarian cancer. The nurse determines that the client needs further instruction when the client says that one of the adverse effects of oral contraceptive use is ovarian cancer. Some studies suggest that ovarian and endometrial cancers are reduced in women using oral contraceptives. Other adverse effects of oral contraceptives include weight gain, nausea, headache, breakthrough bleeding, and monilial infections. The most serious adverse effect is thrombophlebitis. A 22-year-old nullly gravid client tells the nurse that she and her husband have been considering using condoms for family planning. Which of the following instructions should the nurse include about the use of condoms as a method for family planning? Using a spermicide with the condom offers added protection against pregnancy. Natural skin condoms protects against sexually transmitted diseases. A typical failure rate for couples using condoms is about 25%. Condom users commonly report penile gland sensitivity. A typical failure rate of condom is approximately 12% to 14%. Adding a spermicide can decrease this potential failure rate because it offers additional protection against pregnancy. Natural skin condoms do not offer the same protection against sexually transmitted disease caused by viruses as latex condoms do. Unlike latex condoms, natural skin or membrane condoms do not prevent the passage of viruses. Most condom users report decreased penile gland sensitivity. However, some users do report an increased sensitivity or allergic reaction such as rash to latex, necessitating the use of another method of family planning or a switch to a natural skin condom. Which of the following would the nurse include in teaching plan of a 32-year-old female client requesting information about using a diaphragm for family planning? Douching with an acid solution after intercourse is recommended. Diaphragm should not be used if the client develops acute cervicitis. Diaphragm should be washed in a weak solution of bleach and water. Diaphragm should be left in place for 2 hours after intercourse. So here, the teaching plan should include a caution that a diaphragm should not be used if the client develops acute cervicitis, possibly aggravated by contact with the rubber of the diaphragm. Some studies have also associated diaphragm use with increased incidence of UTI. Douching after use of diaphragm and intercourse is not recommended because pregnancy could occur. The diaphragm should be inspected and washed with mild soap and water after each use. A diaphragm should be left in place for at least 6 hours but no longer than 24 hours after intercourse. More spermicidal jelly or cream should be used if intercourse is repeated during this period. After being examined and fitted for a diaphragm, a 24-year-old client receives instructions about its use. Which of the following client statements indicate a need for further teaching? I can continue to use the diaphragm for about 2 to 3 years if I keep it protected in the case. If I get pregnant, I will have to be refitted for another diaphragm after childbirth. Before inserting the diaphragm, I should coat the rim with contraceptive jelly. If I gain or lose 20 pounds or 9.1 kg, I can still use the same diaphragm. A client would need additional instruction when she says that she can still use the same diaphragm if she gains or loses weight. Gaining or losing more than 15 lb or 6.8 kg can change the pelvic and vaginal contours to such a degree that the diaphragm will no longer protect the client against pregnancy. The diaphragm can be used for 2 to 3 years if it is cared for and well protected in a case. The client should be refitted for another diaphragm after pregnancy and childbirth because weight changes and physiologic changes of pregnancy can alter the pelvic and vaginal contours, thus affecting the effectiveness of the diaphragm. The client should use a spermicidal jelly or cream before inserting. A 22-year-old client tells the nurse that she or her husband are trying to conceive a baby. When teaching the client about reducing the incidence of neural tube defects, the nurse should emphasize the need for increasing the intake of which of the following foods? Leafy green vegetables, strawberries, beans, milk, sunflower seeds, lentils. The pregnancy requirement for folic acid is 600 micrograms per day. Major sources of folic acid include leafy green vegetables, strawberries and oranges, beans, particularly black and kidney beans, sunflower seeds and lentils. Milk and fat contain no folic acid. Couple is inquiring about vasectomy as a permanent method of contraception. Which teaching statement would the nurse include in the teaching plan? Another method of contraception is needed until the sperm count is 0. Vasectomy is easily reversed if children are desired in the future. Vasectomy is contraindicated in males with prior history of cardiac disease. Vasectomy requires only a yearly follow-up once the procedure is completed. Another method of contraception is needed until all sperm have been cleared from the body. The number of ejaculates for this to occur varies with the individual and laboratory analysis is required to determine when that has been accomplished. Vasectomy is considered a permanent sterilization procedure and requires microsurgery for anastomosis of the vas deferens to be completed. Studies have shown that there is no connection between cardiac disease in males and vasectomy. There is no need for follow-up after verification that there is no sperm in the cyst. A 39-year-old multi-gravid client asks the nurse for information about female sterilization with a tubal ligation. Which of the following client statements indicate effective teaching? My fallopian tubes will be tied up through a small abdominal incision. Reversal of the tubal ligation is easily done with a pregnancy success rate of 80%. After this procedure, I must abstain from intercourse for at least 3 weeks. Both of my ovaries will be removed during the tubal ligation procedure. Tubal ligation, a female sterilization procedure, involves ligation or tying off or cauterization of the fallopian tubes through a small abdominal incision or laparotomy. Reversal of a tubal ligation is not easily done, and the pregnancy success rate after reversal is about 30%. After a tubal ligation, the client may engage in intercourse 2 to 3 days after the procedure. The ovaries are not generally removed during a tubal ligation, and oophorectomy involves removal of one or both ovaries. A 23-year-old nulliparous client visiting the clinic for a routine examination tells the nurse that she desires to use the basal body temperature method for family planning. The nurse should instruct the client to do which of the following: check the cervical mucus to see if it is thick and sparse. Take her temperature at the same time every morning before getting out of bed. Document ovulation when her temperature decreases at 1 degree Fahrenheit. Avoid coitus for 10 days after a slight rise in temperature. The basal body temperature method requires that the client takes her temperature each morning before getting out of the bed, preferably at the same time each day before eating or any other activity. Just before the day of ovulation, the temperature falls by 0.5 degree Fahrenheit. At the time of ovulation, the temperature rises 0.4 degree Fahrenheit to 0.8 degree Fahrenheit because of the increased progesterone secretion in response to the luteinizing hormone. The temperature remains higher for the rest of the menstrual cycle. The client should keep a diary of about 6 months of menstrual cycle to calculate safe days. There is no mucus for the first 3 to 4 days after menses, and then thick sticky mucus begins to appear. As estrogen increases, the mucus changes to clear, slippery and stretchy. This condition, termed spin parquet, is present during ovulation. After ovulation, the mucus decreases in amount and becomes thick and sticky again until menses. Because the ovum typically survives about 24 hours and sperm can survive up to 72 hours, couples must avoid coitus when the cervical mucus is copious and for about 3 to 4 days before and after ovulation to avoid a pregnancy. A couple visiting the infertility clinic for the first time states that they have been trying to conceive for the past 2 years without success. After a history and physical examination of both partners, the nurse determines that an appropriate outcome for the couple would be accomplished by the end of this visit. By which of the following? Choose an appropriate infertility treatment method. Acknowledge that only 50% of infertile couples achieve a pregnancy. Discuss alternative methods of having a family such as adoption. Describe each of the potential causes and possible treatment modalities. By the end of the first visit, the couple should be able to identify potential causes and treatment modalities for infertility. If their evaluation shows that a treatment or procedure may help them to conceive, the couple must then decide how to proceed, considering all of the various treatments before selecting one. Treatments can be difficult, painful, or risky. The first visit is not the appropriate time to decide on the treatment plan because the couple needs time to adjust to the diagnosis of infertility, a crisis for most couples. Although the couple may be in a hurry for definitive therapy, a thorough assessment of both partners is necessary before a treatment plan can be initiated. The success rate for achieving a pregnancy depends on both the course and effectiveness of the treatment, and in some cases it may be only as high as 30%. The couple may desire information about alternatives to treatment, but insufficient data are available to suggest that a specific treatment modality may not be successful. Suggesting that the couple considers adoption at this time may be inappropriately imply that the couple have no other choice. If a specific therapy may result in a pregnancy, the couple should have time to consider their options. After a thorough evaluation, adoption may be considered by the couple as an alternative to the costly, time-consuming and sometimes painful treatment for infertility. Client is scheduled to have in vitro fertilization or IVF as an infertility treatment. Which of the following client statements about IVF indicates that the client understands this procedure? IVF requires supplemental estrogen to enhance the implantation process. The pregnancy rate with IVF is higher than that with gamete intrafallopian transfer. IVF involves bypassing the blocked or absent fallopian tubes. Both ova and sperm are instilled into the open end of a fallopian tube. The client's understanding of the procedure is demonstrated by the statement describing IVF as a technique that involves bypassing the blocked or absent fallopian tubes. Primary healthcare provider removes the ova by laparoscope or ultrasound-guided transvaginal retrieval and mixes some with prepared sperm from the woman's partner or a donor. 2 days later, up to 4 embryos are returned to the uterus to increase the likelihood of a successful pregnancy. Supplemental progesterone, not estrogen, is given to enhance the implantation process. Gamete intrafallopian transfer and tubal embryo transfer have a higher pregnancy rate than IVF. However, these procedures cannot be used for clients who have blocked or absent fallopian tubes because the fertilized ova are placed into the fallopian tubes, subsequently entering the uterus naturally for implantation. In IVF, fertilization of the ova by the sperm occurs outside the client's body. In this gamete intrafallopian transfer, both ova and sperm are implanted into the fallopian tubes and allowed to fertilize within the woman's body. A 20-year-old primi gravida client tells a nurse that her mother had a friend who died from hemorrhage about 10 years ago during a vaginal birth. Which of the following response would be most helpful? Modern technology has resulted in a low maternal mortality rate. Don't concern yourself with things that happened in the past. In North America, mothers seldom die in childbirth. What is it that concerns you about pregnancy, labor, and childbirth? The client is verbalizing concerns about death during childbirth, thus providing the nurse with an opportunity to gather additional data. Asking the client about these concerns would be most helpful to determine the client's knowledge base and to provide the nurse with opportunity to answer any questions and clarify any misconceptions. Although the maternal mortality rate is low, maternal deaths do occur even with modern technology. Leading cause of maternal mortality in the US and Canada include embolism, pregnancy-induced hypertension, hemorrhage, ectopic pregnancy, and infection. Telling the client not to concern herself about what has happened in the past is not useful. It only serves to discount the client's concerns and block further therapeutic communication. Also, postponing or ignoring the client's need for a discussion about complication of pregnancy may further increase the client's anxiety. A 19-year-old newly gravid client visiting the clinic for a routine examination asked the nurse about cervical mucus changes that occur during the menstrual cycle. Which of the following statement would the nurse expect to include in the client's teaching plan? About midway through the menstrual cycle, cervical mucus is thick and sticky. During ovulation, the cervix remains dry without any mucus production. As ovulation approaches, cervical mucus is abundant and clear. Cervical mucus disappears immediately after ovulation, resuming with menses. As ovulation approaches, the cervical mucus is abundant and clear, resembling a raw egg white. Ovulation generally occurs 14 days, plus or minus 2 days before the beginning of menses. During the luteal phase of the cycle, which occurs after ovulation, the cervical mucus is thick and sticky, making it difficult for sperm to pass. Changes in the cervical mucus are related to the influences of estrogen and progesterone. Cervical mucus is always present. When instructing a client about the proper use of condoms for pregnancy prevention, which of the following instruction would be included to ensure maximum effectiveness? Place the condom over the erect penis before coitus. Withdraw the condom after coitus when the penis is flaccid. Ensure that the condom is pulled tightly over the penis before coitus. Obtain a prescription for a condom with non-oxynol 9. To ensure maximum effectiveness, the condom should always be placed over the erect penis before coitus. Some couples find condom use objectionable because foreplay may have to be interrupted to apply the condom. The penis covered by the condom should be withdrawn before the penis becomes flaccid. Otherwise, sperm may escape from the condom, providing an opportunity for possible fertilization. Rather than having the condom pulled tightly over the penis before coitus, space should be left at the tip of the penis to allow the condom to hold the sperm. The client does not need a prescription for a condom with non-oxynol 9 because these are sold over the counter. A multi-gravid client will be using medroxyprogesterone acetate as a family planning method. After the nurse instructs the client about this method, which of the following client statement indicates effective teaching? This method of family planning requires monthly injection. I should have my first injection during my menstrual cycle. One possible adverse effect is absence of a menstrual period. This drug will be given by subcutaneous injection. With medroxyprogesterone acetate, irregular menstrual cycles and amenorrhea are common adverse effects. Other adverse effects include weight gain, breakthrough bleeding, headaches, and depression. This method requires deep IM injections every 3 months. The first injection should occur within 5 days after menses. Which of the following instructions should the nurse include in the teaching plan for a 30-year-old multiparous client who will be using an intrauterine device for family planning? Amenorrhea is a common adverse effect of IUDs. The client needs to use additional protection for conception. IUDs are more costly than other forms of contraception. Severe cramping may occur when the IUD is inserted. Severe cramping and pain may occur as the device is passed through the internal cervical os. The insertion of the device is generally done when the client is having her menses because it is unlikely that she is pregnant at the time. Common adverse effects of IUDs are heavy menstrual bleeding and subsequent anemia, not amenorrhea. Uterine infection or ectopic pregnancy may occur. The IUD has an effectiveness rate of 98%. Therefore, additional protection is not necessary to prevent pregnancy. IUDs generally are less costly than other forms of contraception because they do not require additional expenses. Only one insertion is necessary in comparison to daily doses of oral contraceptives or the need for spermicides in conjunction with the diaphragm use. After instructing a 40-year-old woman about osteoporosis after menopause, the nurse determines that the client needs further instruction when the client states which of the following. A standard serving of yogurt is the equivalent of 1 glass of milk. Women who do not eat dairy products should consider calcium supplements. Women of African descent are at greatest risk for osteoporosis. Estrogen therapy at menopause can reduce the risk of osteoporosis. Small boned, fair-skinned women of Northern European descent are at greater risk for osteoporosis, not women of African descent. One standard serving of yogurt is equivalent of 1 glass of milk. Women who do not eat dairy products, such as women who are lactose intolerant, should consider using calcium supplements. Inadequate lifetime intake of calcium is a major risk factor for osteoporosis. Estrogen therapy or some of the newer medications that are not estrogen based can greatly reduce the incidence of osteoporosis. When developing a teaching plan for an 18-year-old client who was asking about treatment for sexually transmitted diseases, the nurse should explain that acyclovir can be used to cure herpes genitalis. Chlamydia trachomatis infections are usually treated with penicillin. Ceftriaxone sodium may be used to treat Neisseria gonorrhea infections. Metronidazole is used to treat Condylomata acuminata. Ceftriaxone sodium may be used to treat Neisseria or Neisseria gonorrhea infection and is commonly combined with doxycycline. Client and her partner should be treat herpes genitalis. However, the drug does not cure the disease. C. trachomatis infections are usually treated with antibiotics such as doxycycline or azithromycin. Metronidazole is used to treat trichomoniasis vaginitis, not visiting the clinic because they have been unable to conceive a baby after 3 years of frequent coitus. After discussing the various causes of male infertility, the nurse determines that the male partner needs further instruction when he states which of the following as a cause. Seminal fluid with an alkaline pH, frequent exposure to heat sources, abnormal hormonal stimulation, immunological factors. The client needs further instruction when he says that one cause of male infertility is decreased sperm count due to seminal fluid that has an alkaline pH. A slightly alkaline pH is necessary to protect the sperm from the acidic secretions of the vagina and is a normal finding. An alkaline pH is not associated with decreased sperm count. However, seminal fluid that is abnormal in amount, consistency or chemical composition suggests obstruction, inflammation or infection which can decrease sperm production. A typical number of sperm produced during ejaculation is 400 million. Frequent exposure to heat sources such as saunas and hot baths can decrease sperm production, as can abnormal hormonal stimulation. Immunological factors produced by the man against his own sperm, that is autoantibodies, or by the women can cause the sperm to clump or be unable to penetrate the ovum, thus contributing to infertility. Hope you understood this video. Thank you so much. Please do keep watching.